Hello, everyone. Thank you so much for joining us today. My name is Samuel Schallenberger. I am an Assistant Director of Orientation and Student Development in our College Programming and Orientation Office. Welcome to one of our many online orientation summer series webinars. Today, we are going to specifically be highlighting student wellness on campus and everything related to staying well as you join us this autumn as a UChicago student. We are going to hear about many resources that you can utilize, as well as some things that you can go ahead and get started on right now. As always, with our online orientation summer series webinars, this is being recorded. So if you need to step out, or if you just want to watch it later, or if you just want to rewatch to hear back some of what our panelists have shared, you can always do that, and it will be available on our orientation website. And we'll share that link in the chat just a little bit later. But for right now, I'm going to go ahead and pass it over to Elizabeth Webb, the Director for Health Promotion.
Thank you. Hi, everyone. Thank you so much for being here with us today. As mentioned, my name is Elizabeth Webb. I'm the Director of Health Promotion with UChicago Student Wellness. And I'm here today with my colleagues, Ann Brody, our Interim Director of Counseling, Celia Bergman, a Program Manager, and Richard McDonough, who's our Senior Medical Director. And you'll be hearing from all of us today. And we're here just to tell you a little bit about UChicago Student Wellness. We'll talk about services and programs that we offer, how to access them, and how to prepare for your time at UChicago before you get here. We'll talk about our student health insurance plan, and then we'll leave some time at the end for any questions that you may have. So at UChicago Student Wellness, we provide students with comprehensive medical, mental health, and wellness services to support your academic, personal, and professional success. We have a really large multidisciplinary staff that is comprised of physicians, nurses, we've got medical assistants, psychologists, psychiatrists, social workers, and public health professionals. Everyone is really highly trained in addressing the needs of college students, and we're a diverse group with various identities, backgrounds, and specialties, and we're really committed to providing care that's inclusive and strive to support our diverse student community. We're made up of 3 functional areas. We have our medical, mental health, and health promotion. And throughout our time together today, we're going to go a little bit more in depth into each of those functional areas and the services that we provide. Most of our services are covered at no cost for students who are actively enrolled in eligible programs of study. If you're unsure if you're eligible, please feel free to contact your Dean of Students office to determine your eligibility. But for the most part, most students are eligible. But you can check in on that if you're unsure. So I'm going to pass it over to Dr. McDonough to talk a little bit more about our medical services.
So hello, everybody. I'm Richard McDonough. I'm the Senior Medical Director here at University of Chicago Student Wellness. I'm a board certified family physician, have been for several decades, and am privileged to be the medical director at UChicago Student Wellness. And we'll go through a few slides, and we'll start with the where, and we'll follow with the what, and then we'll maybe end with the how. But to begin with the where, physically we're located at the northeast corner of Maryland and 59th Street. And all of you coming to the campus will become familiar with the geography here. We're just north of the Midway, and we are now located in a beautiful space. What used to be the Chicago Lying-In Obstetrical Hospital. They repurposed the space on our behalf, and we came here in 2020, several weeks after coming into the building. The city of Chicago and the whole nation shut down for COVID. But when you have a chance to see our facility, it's gorgeous. They preserve the exterior Gothic brickwork that is stonework that's so characteristic of the university, but we have gorgeous space internally. In order to reach us, you'll get tired of hearing this number, but you can call 773-834-9355. That's 834-WELL. You can see on the screen there's a phone number for the University of Chicago Police Department for the therapist on call. So we have a multiplicity of services available to all of you. But if your question is, what are you? And essentially, we are a primary care clinic, and not unlike the pediatrician's office that you've gone to over the years, or the family practice clinic where you had your checkup, or the parents online, we're like the internist's office. We take care of acute and chronic medical problems. So we can address, your infectious mononucleosis or your abdominal pain, your ankle sprain. But we also take care of preventive healthcare needs with checkups, with travel visits. We take care of a lot of gynecologic care here in the clinic, with preventive visits for pap tests and contraceptive management. We can diagnose and treat sexually transmitted infections. So we have a staff of 6 physicians and 4 advanced practice nurses. And we have a great collegial relationship with the University of Chicago Medicine. We are part of the university. We're not part of the University of Chicago Medicine, but all our providers must be credentialed by the strict standards that the University of Chicago Medicine has. So we have access to world-renowned specialists from UCM if we need them, but we have a very capable group of providers. They're supported by registered nurses and LPNs and medical assistants and phlebotomists, and they in turn are supported by a group of wellness coordinators that take your calls and allow us to route you to the right disposition. We do, as I mentioned, laboratory testing. We administer immunizations for the immunizations that are required by the state of Illinois. COVID vaccines and flu vaccines. We do allergy injections. So there's a multiplicity of services here. Our providers are excellent clinicians. Some of them have special expertise in the care of special conditions. We have providers that are capable of taking care of eating disorders and alcohol dependence. We have providers who can administer the special medical needs of particular groups like the LGBT community. So we feel we have great providers. To the parents who are part of this Zoom call, part of my responsibility has been hiring people over the past 3 to 4 years. And I would just let you be reassured that if your son or daughter were to see one of our providers, they are excellent clinicians and actually very warm, welcoming human beings. So please rest assured that your sons and daughters will be well cared for. As far as how do you access the clinic, we're open from 8 o'clock in the morning to 5 o'clock at night, 5 days a week. Again, that number 773-834-9355. You can call that to make an appointment. You can also go online to the My Wellness portal and establish an appointment via the portal. The logic that's built into the software allows you to do certain visits, not everything, but it's one way for those of you who are a little uncomfortable talking to people on the phone to organize your own appointments. As far as after hours care, we always get a lot of questions about after hours care. There's a provider on call 24/7, and that includes the weekend. That number, again, can be called, and we do have a 24/7 nurse line for nurse advice that's been sponsored by United Healthcare. And again, there's access to providers. We have urgent care facilities in the area, but their hours sometimes mimic our own. So when your son or daughter is needing care at 11 o'clock at night or 1 in the morning, sometimes our default is the care that's administered by the University of Chicago Medicine emergency room. And we're kind of blessed and cursed with our relationship there. Again, for the parents, if your child were ever to be seen at the emergency room, they get uniformly excellent care. The downside is that the University of Chicago is a level 1 trauma center and is located in the south side of Chicago. So sometimes your son or daughter's sprained wrist or laceration may take lower priority than the type of care that's administered given the nature of the level 1 trauma center. So again, providers are available to advise at night and arrange for care. After hours, the CVS and Walgreens have walk-in clinics, and they're available on the weekends. Emergency services we don't provide in the clinic itself. There are fees that are associated with being seen in the emergency room. The student fee services fee does apply for pretty much all the services that are rendered within the clinic itself. There are some rare exceptions. If a provider requires an unusual blood test, there may be an insurance claim that's generated, but for the most part, again, all the services rendered within the clinic are pretty much without cost. The next slide kind of points out what you can do to prepare for the coming to our campus. You can always establish a primary care physician visit. If you have a particular healthcare need that you want addressed, you can look at the profiles of the providers online and choose. Immunizations, as of August the 8th, immunizations will be available to within the clinic itself. And there's a date of October the 20th by which all the required immunizations must be submitted. If you have a maintenance medicine of some sort, it would be great to have a 3-month supply that you could bring, and we can help you with refills going forward. And again, we have nurse navigators that serve us, and if we have chronic illness issues that need to be addressed by subspecialists, we have a very healthy relationship with our subspecialists from the pediatrics department at the University of Chicago, as well as the internal medicine department. So we have nurse navigators that can help you get connected with specialists if need be. That last slide is just a list of things that you might need going forward. My guess is your parents already have this packed and ready to go. So thank you all for your attention. I'll turn it over to Ann.
Hi, everyone. Yeah, I'm Ann Brody, and I'm just delighted to be talking with you today. Welcome to UChicago. I am the interim director of the counseling unit at UChicago Student Wellness. I'm a psychologist. I've been practicing over 30 years, a lot of time here. So I'm really happy to be here with you today. So UChicago Student Wellness offers high quality, accessible, and culturally sensitive mental health care to address a wide range of concerns. We have a diverse team of psychologists, social workers, psychiatrists, advanced nurse practitioners, and trainees that are here to serve your students, and high quality clinicians, all of them. Some services that we offer, short-term individual and couples counseling. When we say short-term, brief therapy, there is no set limit of the times students can meet with us. We average about 6 sessions for students. Some students come to us a lot longer. Some don't need us for as long. That's by design. We offer brief therapy because we also don't run a waiting list. We get students in for a triage appointment always within 5 business days. So we aren't able to keep students forever, but they can always come back. So ostensibly a student could meet with one of our clinicians a handful of times during autumn quarter of first year and come back in the winter quarter or the next year, or as much as they need to. For students that need more open-ended psychotherapy help, we refer to clinicians who we know in the community, and we help them get connected. We also offer couples counseling as well. We have psychiatry services. Our psychiatry team, unlike the therapy team, can and do keep students over the lifetime that they are students with us. The reason they can do that and the therapist not is because if someone is on a course of medicine and stable on the medicine, they may only need to see them every 3 or 6 months. So they do follow students for the entire lifetime that they're UChicago students. We have therapy and support groups for international students, LGBTQ community, students of color. Again, we offer referral services. We have 2 full-time clinical case managers who will help students get connected for possibly a higher level of care or ongoing psychotherapy in the community. We have an academic skills assessment program, and this is a small program within our larger therapy program. And it is a program that really serves two functions, primarily for those students whose main problem has to do with some kind of an academic struggle, having trouble getting work done on time, having trouble managing the reading, whole host of things. And that's the main problem, that they may get some brief counseling around that in our setting. Another really great purpose of having ASAP within the counseling service is that sometimes students, for whatever reason, are hesitant to make a mental health appointment, but our students anyway will be willing to make an appointment to address some kind of an academic concern. And it may be once they come in, they're talking with one of our psychologists, who is the same team that's our psychotherapists, and we discover, you're really depressed. We can help you with that. No wonder you can't concentrate. So that's another one of the services that we offer. We have psychoeducational workshops. How to find us is important. For the first step is to have a triage appointment. And to get a triage appointment, the students need to simply call us up and make an appointment. We don't currently have online scheduling for counseling. We know students would like that, and we're working on finding a way to do that in a way that's possible. For now, if they just call the 834-9355 number, they'll be scheduled for a triage appointment, and that is the first stop for mental health care. And the triage clinician will work with them to determine what makes most sense: ongoing brief therapy, possibly psychiatry. Students, if they're switching psychiatry services to a local provider, we can get them in to be followed for medicine that they're already on, or be evaluated for a new concern. Another conduit for counseling is Let's Talk. And this is our attempt to lower the bar as far as we possibly can for mental health care. This is informal, confidential, it's anonymous, drop-in consultations at settings outside of our building. Students can give their names, but they don't have to. They can stay 10 minutes or 30 minutes, and they can come back as much as they want. So again, this is for students who, for whatever reason, may be less inclined to come in our building. And our Let's Talk sites are staffed by our clinicians, so our psychologists and our psychiatrists. We have urgent care counselor available during our working hours. Students can walk in. And again, we define emergency by the experience of the student. So if it feels emergent to you, we'll see you right away and make plans for next steps. We also have a therapist on call 24/7. If students call 702-3625, a clinician will pick up, and they can speak to a clinician anytime during business hours or during the weekends and at night. And all services at the counseling side are free, as long as students are eligible, are registered eligible students. And our website is here to learn more. Then I want to say something about preparing for the academic year from a mental health perspective. If you plan to transfer your care to a UChicago psychiatry team member, you want to contact Student Wellness as soon as you arrive on campus to schedule a triage appointment. And please, remember that our prescribers will do a very thorough independent assessment and make their own treatment recommendations based on that assessment. Now, if someone has been on a medicine that's been working for them for years and years, likely they will continue on that. But just to know, our own team will do their own assessment and make treatment recommendations accordingly. If you plan to continue treatment with your current provider, you want to make sure that you arrange a 3-month supply of medication when possible. Consider giving your prescriber information to a local Chicago pharmacy. Again, call to schedule a therapy intake appointment. You can also schedule appointments at our open house on September 19th. And then I want to say one other thing about a service that we've now been contracted with for over a year, and it's working very well for our students at University of Chicago. The University of Chicago Student Wellness offers access to Timely Care, which is a leading telehealth company specializing in serving students. This service was designed to increase convenience and access to mental health care, and it complements the in-person and virtual services offered through student wellnesses. All eligible students have access to Timely Care, which includes Talk Now. This is a 24/7 on-demand access to a mental health professional about any concern. You can have a virtual or a phone appointment, a scheduled counseling visit. All University of Chicago students can have up to 12 sessions per academic year, and that clock resets annually. So September 1st through August 31st, every UChicago student can have a free 12 free counseling sessions. There is psychiatry also through Timely Care. These appointments are referred through UChicago Student Wellness or a Timely Care treatment team. So those are the one appointments the students don't sign up for on the app directly, but they will be referred to a psychiatrist if that's what's needed. There's also health coaching provided by Timely Care. It supports lifestyle changes, healthy habits, transition from home to campus life, weekly guided meditation, yoga group sessions, specialized sessions throughout the year. And Timely Care is available in all 50 states. So all the students have to do is download the app, create an account, which is very easy for them to do. And this is really wonderful, especially when students are home in the summer or, need to travel. They can have a therapist who is licensed in the state where they are. Elizabeth?
Thanks, Sam. I saw there was a question also about eligibility for Timely Care, and it's the same eligibility as all other services. So I'm going to talk a little bit about our health promotion programs and services. We've got a team that's really well trained, super dynamic. We've got students on our team as well, and we really focus our programs and services on supporting you in your well-being and meeting you where you're at. So we very much come from a holistic and inclusive approach that includes the 7 facets of well-being that are up on the screen here. And it really stresses the importance of finding and maintaining balance within each of these areas in order to be holistically well while you're here. So the facets of well-being include emotional, environmental, intellectual, spiritual, physical, financial, and social well-being. And so we have programs that focus on a plethora of those things, and also several of those are cross-functional as well. So on this slide, you can see a few different programs and services that we offer. We've got mindfulness meditation courses, restorative yoga. We offer mental well-being trainings for students as well as faculty and staff. We somewhat more recently have a student recovery group. We have various types of outreach and education. We also offer safer sex supplies through our WellSR program, which is one of our student groups. So if you're interested in joining a student group, I highly recommend it. That is through housing, and it's a really great way to get involved and help spread the word about our services and help your fellow students be more healthy. And then in terms of accessing us, most of our offerings require no appointments. Oftentimes we're located throughout campus and you can find us in different locations, but for services that do need an appointment, you can also schedule on the wellness portal, and we'll be giving a little bit more instruction on that in a minute in case you have a question about that. But as mentioned, there's also other ways to get involved with our student groups. So we've got our peer educators, our WellSRs, who again are in housing, we have our student health advisory board and our wellness advisory board. So lots of different ways to get involved. And please just note that all of our services are completely free. So all health promotion services and programs, including yoga, mindfulness, etc., are completely free for all students. And then just in terms of preparing for the academic year, again, consider being a WellSAR, can't emphasize that enough. Take a look at our health promotion events. We've got a lot. I think it's actually very beneficial to follow us on social media. That's where we post a lot about where we're going to be, what we're going to be doing. We'll have a link for that in the end, but we have a couple things already scheduled for autumn quarter. And then it's really important to be proactive. So coming in, making sure that you have a plan in mind, have some phone numbers stored away in your phone so you can access us, access UCPD if you ever need to get to them. And then obviously having our address in there is really helpful as well. So just trying to think about being proactive before you come to school is really important. And I'm going to pass it off to Celia.
Elizabeth. All right, so I get to talk about the fun topic of health insurance. My name is Celia Bergman. I've been at the University of Chicago since 2005, worked in a variety of capacities, and currently am the program manager in charge of the student insurance program from the university side of things. And then I'm also helping student wellness with the compliance aspect of our immunization program. And as you know, the state of Illinois requires a whole host of immunizations for incoming students. But right now I'm going to talk about insurance. So some of you have already probably heard this acronym, USHIP, stands for the University Student Health Insurance Plan. And this is a product that we make available to all full-time students at the university. It is provided to us through United Healthcare Student Resources. We had a very competitive bid process this past year where we entertained several other carriers and ended up renewing with United Healthcare Student Resources. We have a very good relationship with them and feel very comfortable with them. So the university does require all registered students to have health insurance. They don't have to have USHIP, but they do have to have health insurance. And of course, USHIP we consider as a very high quality option. It is platinum rated by the ACA. And it does provide obviously very robust levels of coverage. It is available again to all full-time students at the university, and we do automatically assess an insurance fee on the student's account until the student waives USHIP if they want to waive with comparable insurance. So if you see that health insurance premium amount on the student's account, that just means that that's a placeholder because students who don't waive by the deadline will be then default enrolled into USHIP for the rest of the year. So we will start sending out messages the first week of August to all incoming as well as returning students about the USHIP enrollment waiver deadline. This year, the deadline is going to be October 13th. So it's always the third Friday of the quarter. And if you want to enroll in USHIP, you can do so before October 13th. If you don't take action before October 13th, then we will just default enroll you for the rest of the year. Again, students can waive if they would like to, if they have alternate insurance that's comparable to USHIP. And on our student insurance website, we have a list of the comparable coverage requirements. One of the essential components for alternate insurance to be comparable is that it must provide both emergency as well as non-emergency care in Chicago. So some of the out-of-state HMOs would not necessarily meet our comparable coverage requirements, so you're going to want to look at that definitely ahead of time. But you do have until October 13th to make your decision whether or not you will be enrolled in USHIP for the year or waive with comparable coverage. The USHIP coverage does last for the full year. September 1st is the start date through August 31st of the next year. And of note for the students who are enrolled in USHIP is we have a great resource on campus. We have 2 United Healthcare employees who actually are dedicated to our account. They are situated within student wellness, and they are there to help answer students' questions about USHIP, enrolling, waiving, and then for those students that remain enrolled, if there's any questions about billing or cost of care, these advocates on campus are a great resource. And they are generally available on a walk-in basis. Most of the questions that you might have about the insurance enrollment waiver program are on our website. You can see the link there on the slide. And I would definitely encourage you to start checking that out. New students for autumn quarter will be able to start making their enrollment waiver decisions starting with the first week of August. So it's still a little bit early to get on and enroll or waive USHIP, but that first week of August, again, we will be sending out email reminders for students to take action. And next slide. I'm also going to just quickly talk about a fee that you'll also see on your student's account called the student service fee. And this is a fee that all full-time students are assessed at the University of Chicago. Regardless of what your insurance is, you will be assessed a student service fee. And this fee actually covers a variety of programs and services across campus. Part of it is for student wellness access, but actually the fee covers much more than student wellness. We do want to make sure that you understand that even if you waive USHIP, you will still be assessed the student service fee each quarter. And students who are taking some time out, maybe going on a leave of absence, or perhaps going on a study abroad program, those students would not be assessed the fee during the quarters when they are considered ineligible. And then the next slide talks about the wellness portal, which if you haven't started checking it out, you can definitely do so right away. All incoming college students should already have access to the portal where you can start to upload proof of your immunizations. The wellness portal is sort of a one-stop shop for all of your interactions with UChicago student wellness. You'll be able to accomplish a variety of tasks through your wellness portal. You do need your CNET ID and a password in order to access the portal. But again, you should already have an account, so please go ahead and start checking it out. And then the final slide here shows you some of the actions that you can take through the wellness portal. So for example, you can schedule many different types of appointments for health as well as counseling, as was just discussed. You can also submit your immunization records to comply with the state of Illinois requirement. You can also make appointments to get needed immunizations. So if there's a required immunization that you don't yet have, you can get it at Student Wellness and you can make your appointment through the portal. For students who are under the age of 18, they can submit their minor consent form. So a parent or guardian has to complete that form on behalf of the student and then submit that to the wellness portal. You can also view and print your immunization history. You can communicate securely through the portal with your providers at Student Wellness. So there's a secure messaging component to it. So that's just some of the functions that you can participating through the wellness portal. And we're really happy to have this portal. It's still pretty new for us and we're always rolling out new functionalities, but so far the feedback on the portal has been very, very good. So I do invite you to go ahead and check it out now this summer when you have a little bit of downtime and start to get familiar with it. And that is it for me at the moment. Thank you.
So we're gonna wrap up here and allow for questions. I know there are a few that have been unanswered in the question and answer box, so we'll get to those as soon as possible. But just in general, when thinking about your wellness before coming to UChicago, it's just important to be proactive. Try to identify your needs before getting here, develop a plan, just make sure you're, ready to go before starting school. It's also really important to connect with other people, talk to people that you trust and who can support you. And social support is a really important part of your well-being while you'll be here. So that's an important piece of it too. And then of course, if you need to, and when you need to, always seek professional support. So you can always reach out to Student Wellness and other campus resources. So feel free to reach out at any point. You can always call us with the numbers that we've provided. And then on this next slide, we have a few other ways to get involved or connect with us. This is our website. We also are on Facebook and Instagram. And again, Instagram is a really great place to start in terms of trying to find programs that we're offering, services, even hours. Sometimes are posted on there if we have shortened hours due to holidays. So it's a really great place to find out information, as well as the website and the student portal. And then we will have an open house. So we'll be offering an open house on September 19th. You'll find more information about that later, but it's a really good opportunity to stop in, see our space, talk to providers, talk to folks who work here, and just ask any other questions that you might have. So speaking of questions, we will open it up. I know, again, there are a few that are already in the Q&A box that I don't know if they're, I saw a couple about immunizations and insurance. So Celia, I don't know if you want to hit the insurance ones first.
Okay, let's see if I can find them. The UShip premium for this coming year, hold on just a second, is the annual premium is $4,917, but that's broken up into 3 installments. So we have an autumn installment, winter, and spring. And the spring installment automatically also includes the summer months. So between the end of spring quarter and September 1st of the next year, that's rolled into the spring coverage. So again, the annual premium is $4,917, but it's broken into 3 equal installments. So that's the total premium. Let's see what else. So UShip coverage is binding for the year. So if you enroll in UShip autumn quarter, that coverage is binding until the following autumn quarter when you make your insurance selection again for the next year, because it is an annual process. There are certain situations called qualifying life events that allow a student to either add UShip mid-year or waive UShip mid-year. Examples would be aging off of a parent's plan. When a student no longer has coverage through a parent, then they can add UShip mid-year. Or perhaps a parent gets a new job mid-year with new insurance. And so the student wants to waive UShip mid-year because they are going to be added to their parents' insurance mid-year. So there's certain situations that allow for mid-year changes, but by and large, the insurance selection that you make at the beginning of the year is binding for the rest of the year. So hopefully that answers that question. Vision and dental insurance. So UShip does not provide vision and dental, except there is a pediatric component. However, that's usually for students who have children on the plan. But we do make available 2 different programs for vision and dental. It's optional. Students don't have to enroll. They don't have to take action to enroll or waive each year for the vision and dental like they do for USHIP. We will be announcing the programs that we'll be providing for the 23-24 policy year at the beginning of August. Again, it's optional. You can enroll in a 6-month coverage or a 12-month coverage. If you don't enroll in coverage at the beginning of the year, you do have an opportunity to enroll in vision and dental again, starting with, what is it, March 1st is when the new coverage starts. So that again is optional, it's available, and we will start communicating with students about that in early August. And let's see, I see a question about the student service fee. I don't know if that's been posted yet by the bursar's office. Let me take a quick look on another site and see if I can find that for you. If anybody else wants to jump in while I'm doing that, feel free.
I just looked and I don't think it is posted yet.
Okay. Let me just look one more place just in case. Well, my computer's being very slow. Tuition and fees. So I'm on the Bursar website, bursar.uchicago.edu. There's a button that says tuition and fees. Tuition and fees for 23-24. I'm just talking you through this so you can find it on your own as well. So in the college, tuition and fees for 23-24. The student service fee is $500 per quarter. That's for the upcoming school year. Okay.
Celia,
Oh yeah, I'm sorry. I just saw that health insurance is considered part of the annual expenses for purposes of financial aid. So if you're filling out the financial aid worksheet with the estimated cost of attendance, you can include the cost of USHIP if you are planning to enroll in USHIP. And I think there's a question about making appointments with a primary care physician. So that would be through the wellness portal. You would select what sort of service you're looking for. And yes, you should be able to do that as early as August 8th. Okay. Did I miss anything?
Celia, there was another question about access to vaccines, and that's the same answer, is it not?
Yes, through the wellness portal, go ahead and select what type of an appointment you want. You would select immunizations and then which ones you want. And again, you can do that starting August 8th.
For the question about if our insurance is comparable, are the services covered at no cost? I'm assuming you mean the free services that are offered at Student Wellness. The free services, all the services that are offered at no cost at Student Wellness are offered at no cost regardless of your insurance. So if you are an eligible student, you will receive free services at Student Wellness regardless of the insurance that you're on.
This question about students being covered internationally, I'm assuming that's regarding the insurance. And yes, if the student enrolls in USHIP, USHIP actually has worldwide coverage. What happens when a student is on USHIP and maybe they are studying abroad for a quarter is while overseas, they would pay out of pocket initially for services because most international providers, they don't know what USHIP is. They don't know anything about that. So the student would pay out of pocket for services and then seek reimbursement from United Healthcare by submitting proof of receipts. And those services would be reimbursed at an in-network level. So that's a really nice feature about USHIP.
We have a couple more questions that were submitted through the registration page for today's webinar, so I'll toss just a couple at you. To start, can non-Illinois doctor prescriptions be filled in Chicago by your services?
I think Dr. McDonough may want to address this. When you say filled prescriptions, that's a pharmacy question. We don't. Yeah, go ahead, Dr. McDonough.
So I can't see the question, sorry.
Sorry, yeah, it was just submitted through the registration page, so it's not in the Q&A, but essentially if a student is coming with a prescription that was given by a doctor not in Illinois, can it be filled here?
Yes, in large part, the prescriptions can transfer state lines. In Illinois, you're not allowed to call in a prescription for opioids for pain relief and things like that. So there are some restrictions, but largely there are no impediments to phoning prescriptions in.
Perfect. And what is the specific documentation needed to show that a new student is covered by their family's health insurance? And is that submitted through the wellness portal?
So that is a different portal. It is through United Healthcare Student Resources. They manage our enrollment waiver platform, and that will be available starting the first week of August. So at this point, there's no action to take other than just check to see if your alternate insurance is comparable to USHIP. Our comparable coverage checklist is on the student insurance website. So just go to studentinsurance.uchicago.edu and you'll see a button that talks about waivers and how to submit a waiver and what is considered comparable coverage. So you can see that on our website.
Perfect. Thank you all so much. Don't see anything else in the Q&A for right now. My colleague is going to pop in our information in the chat so that you know where to access this webinar in the near future, as well as all of our other webinars throughout the summer. So if you do want to go back and watch any that you may have missed, or again, if you had to join a little bit late today, we will have this recording up and live very soon. Please be sure to join us for our upcoming online orientation summer series webinars. And thank you so much to each of our panelists for joining us today. We really appreciate it.
Thank you.
Be with you. Bye.
Bye-bye.